Good afternoon. I'm Menna Hegazy, radiology resident at Alexandria Main University Hospital. First of all, I would like to thank our dear professor for their support and guidance to present these interesting cases today. Today's case is about a 27-year-old male patient presented with jaundice and right upper quadrant pain. He had a free past medical history. At that time, the clinician requested a CT study. This was done in September 2024. Let's take a look at the CT. Let's take a look at the CT. This is the venous phase. And this is the arterial phase. As you can see, it shows multiple focal hepatic lesions, showing no specific pattern of enhancement. Usually when we're presented with focal hepatic lesions of no specific pattern of enhancement and no specific past medical history, we think of them as being primary malignant lesion or metastatic deposit, or they can either be inflammatory. The radiologist at that time reported heterogeneously enhancing focal lesions and requested biopsy. The clinician also requested tumor markers, CA, CA19, 9-alpha fetoprotein, and as you can see, they showed no significant increase. The patient then lost follow-up and did not take any medications, and after 2 months he returned back to the clinician with the same complaint, and another CT was requested. Let's look at the follow-up CT. This is the venous phase. And this is the arteria. Surprisingly, you can see that the focal hepatic lesions have regressed in size and number. And this is the follow-up, and this was the first one. So what do you think the diagnosis? As per the radiologist's recommendation, the patient was referred for biopsy. He took it from segment 7 of the liver. The biopsy report revealed his lymphoplasmocytic infiltration with focal interface hepatitis. Immunostaining was recommended. It also shows moderate lymphoplasmocytic infiltration on background of focal interface hepatitis, and no neoplasia was detected. Comparing the previously mentioned CT studies and the regressive course regarding the number and size of the noted focal hepatic lesion and lymphoplasmocytic infiltrations reported on the pathology, IgG4-related disease with inflammatory hepatic pseudotumor was highly suggestive. And if we go back to the first CT study, yeah. We can see that there is CBT is dilated with delayed mural enhancement. So the pathology was not only involving the focal hepatic lesions. Subsequently, laboratory tests were ordered and immunoglobulin IgG4 was elevated, and the patient was prescribed corticosteroid medication, and after 3 months, the lab tests were revealed and the bilirubin level regressed to normal and the jaundice was resolved. Looking at the literature review, we can see case report in 2018, similar case, a spontaneous resolution of IgG4-related hepatic inflammatory pseudotumor. At that time, it was a 50-year-old patient presented with epigastric pain. The diagnosis was chronic pancreatitis. Yet CT study was requested, which revealed a focal hepatic lesion at the right lobe of the liver. The biopsy was ordered and it revealed also lymphoplasmocytic reaction with dense fibrosis. The patient then was recommended to go for follow-up in the outpatient clinic, but he lost follow-up, and a year later he returned, and there was spontaneous regression, and the focal hepatic lesion was no longer seen. It was also diagnosed as IgG4 hepatic inflammatory pseudotumor. This is another case in 2021. This time it was misdiagnosed as cholangiocarcinoma because of the delayed enhancement it shows of the focal lesion. It was a 70-year-old female patient with past history of rectal cancer. At that time, malignant lesion couldn't be ruled out, and the patient requested immediate liver resection. This is an MRI. Post-surgical resection biopsy also showed fibrosis and lymphoplasmocytic infiltration. Therefore, IgG4-related inflammatory pseudotumor should be included in the differentiation of liver tumors with no typical imaging finding, and it's essential to make a histological diagnosis such as biopsy, especially before taking any treatment measures. Thank you.
شكرا دكتورة منى على البرزنتيشن الجميل ده، وحقيقي الواحد سعيد بالحالات اللي طالعه من عندنا من القسم. بدعو الدكتورة دعاء ياسر لتقديم الحالة القادمة إن شاء الله.